By the end of this video, you will learn 7 home remedies that can alleviate your pain. And one of these things can actually cure your tooth pain for good. Welcome back, Dr. Choi.
Hi, everyone.
The crowd has spoken. They want to see more of you.
I know.
Coming out with a new look too.
Oh yeah, I know. I'm evolving like Pokemon. Yeah.
This video is going to cover a really important topic.
Yep.
Because chances are, if you live a long, good life, you will have experienced this at one point. So let's go right into it. Let's start with number 7, which is
Drugs. It's only for the short term.
There's ibuprofen, Motrin, there's acetaminophen, Tylenol. Is there a difference?
Yes, there is. So ibuprofen has anti-inflammatory aspect to it. So it is more effective when your toothache is coming from the inflammation, and most of the toothache is coming from inflammation. So it really helps a lot. But Tylenol works too.
In some cases, the tooth pain can't be managed by just ibuprofen.
Right.
Can you safely mix both?
Yes. So I usually tell my patients to take 600 milligram ibuprofen every 6 hours. So if it doesn't work, what you can do is you can take acetaminophen, which is Tylenol, in between.
Many patients have found relief from mixing and staggering these.
Yes.
For example, 6 a.m. ibuprofen, 9 a.m.
Tylenol,
12 p.m. ibuprofen.
keep going in.
We put this first on the list
Right.
because oftentimes it does provide immediate relief. We don't want you to get dependent on it though.
Right.
Unfortunately, we do see that in the office. How long have you been on your pain meds? Oh, like 2 months.
Yeah.
So be careful. We do want to treat the source of it. Let's go into number 6, which is
Avoiding the trigger. Stop testing it.
Oh,
If
good
the pain is still there, just let it sit. Let it give some time.
That's perfect. I think oftentimes we want to keep diagnosing ourselves. It's like, oh, maybe it's better now, an hour later, so let me chew on this thing again.
Yeah.
It's like, oh, it still hurts.
Yeah.
So, okay, we don't blame you because you do want to see if you got better. Think of it as a muscle soreness or a sprain. You working out that body part every 2 hours is not going to help it. So what is a recommendation that you would make?
Soft food diet. It's a real thing. Mashed potatoes, yogurt.
Drinking stuff.
Yes.
And if you're wondering how long you should do that, typically a soft food diet interval is up to 10 days.
2 weeks.
If your pain's is lasting longer than 2 weeks on soft food diet, you should probably get it checked out.
Yeah.
Let's go to number 5.
Cold compress.
So ice.
Yeah, ice.
Does it work?
It does. It really does. Pain is coming from the pressure. Ice will shrink down the blood vessel, and also the coldness will numb the area. So it helps with the pain as well. So that's a little extra.
No, that's a good point.
Yeah.
So you want to wrap your
Yeah.
ice in a towel. Don't put direct contact to your skin. And go in intervals, 15 minutes
Yeah.
on.
I usually say 20 minutes on, 20 minutes off.
It helps. for
Yeah,
sure.
it helps. It helps.
Now, this next one, number 4, might not be as obvious, but I love this one. What is it?
Head elevation.
Head elevation.
Yes.
So some of the pain can be aggravated when sleeping.
Yeah.
Because
when you're laying down.
position of your head. Easy remedy, and many find relief from this, is prop up a few pillows
Yeah.
so that you're sleeping on an incline.
Yeah, exactly. So that you can relieve the pressure around the sinus and also the jaw area. That's gonna help a lot.
For sure. Number 3,
Warm salt water rinse.
warm, lukewarm also.
Yep. Not too hot. You don't want to put anything hot there. Okay, please don't.
Not too hot, not too cold.
Yeah.
Fun fact, it's actually part of a lot of post-operative, meaning after treatment, remedy.
Yeah, after extractions, after any surgery. Yeah.
So what does the salt in the saltwater rinse do?
So salt is a natural anti-inflammatory agent. So it reduces inflammation and also it inhibits the bacterial growth. So it helps healing. So yeah.
That's perfectly stated. You need a cup of water
Yep.
and you need a teaspoon of salt. You're going to mix, stir, and then rinse.
Yeah, rinse for 20, 30 seconds and then you can repeat.
Repeat with a different, not the same.
Ew, who does that?
I'm just saying.
Spit out the cup and then you do it again?
Do you You never know what people are doing. You never know what people are doing. I'm just saying. The absolute best way to avoid tooth pain is to prevent it. We all know that. But what you might find surprising is that many brushes out there are simply too abrasive for your gums. It's important to keep in mind that your actual brush and the technique with which you use it matter. What I love about the Laifen Wave is that we designed a brush that will minimize gum recession while maximizing your cleaning. And the Laifen Wave does this with 3 key features. Number 1, it utilizes both vibration and oscillation up to 60 degrees. Number 2, extra soft tapered bristles, allowing for a gentler cleaning. And number 3, the intensity can be lowered. As someone who has had gum recession before, I know that I have to be gentle on my gums. I recommend that you do the same and that you check that your electric brush is not too abrasive. Even if you don't get this brush, watch the previous video and make sure you're doing everything you can to prevent damage while you're brushing. Find something that works for you and that does what it's supposed to. All right, now back to the show. This one's really interesting.
Yep.
Number 2.
Use something in your pantry.
This is a fun one.
Yep.
Because there are certain foods that you can stick in your mouth that can make you feel better.
Yeah, it's a very weird concept.
And we're not talking about cake or the Nutella, all right, things that will make you feel better because it tastes good.
Yeah.
It's things that actually have properties in them.
So
what are some of these things in your pantry?
The first thing I can think of is a tea bag. Peppermint tea bag has anti-inflammatory aspect as well. Bite onto the tea bag, or you make a tea and then drink the tea, but not too hot.
There's another one that people swear by. Personally, I don't do it. Garlic. So you can crush garlic and then stick it onto your gums.
Oh yeah, I can smell it from here.
I mean, if you're feeling sick, I don't think you're seeing anyone anyway. But
I smell the kimchi breath right now.
it would be nice if kimchi was part of the remedy.
I love kimchi, by the way, like, don't get me wrong. This is tasty, but yeah, oh my god.
The last thing, the last remedy, which can actually solve your tooth pain, depending on the source of it. Number 1,
removing food impaction.
How common is this?
It's pretty common. So if there's no sign of cavity or no sign of infection, then most likely it's a food impaction.
Or foreign objects?
Foreign objects, yeah.
I haven't had to go fishing that much. Do you fish out?
A lot.
Oh, do you go fishing in the gums?
Oh yeah. I always do.
What have you found?
Oh, a lot of things, like some veggies and yeah, some green stuff, and usually popcorn kernels.
That's a big one. So you can try dislodging some of these deeper food impactions yourself. Without hurting yourself, there are 2 remedies. Talk about the first one. Take a long piece of floss, tie a knot in it. If you need a thicker knot, you could do a double knot. And you'll have a little ball that you can floss through and then you can thread together. That oftentimes dislodges most of the food impaction. Is there another remedy that you recommend?
There's a little thing that we call interproximal brush. It looks like a little Christmas tree, very small brush. Yeah, so you just use that brush between your teeth and then make sure there's nothing there.
Cool.
And then you might find something, you might hit jackpot. Something might come out, like, ooh.
A second meal.
Oh yeah, a second meal.
Save it for later. Through these tips, we hope you find relief. Ultimately, you want to make sure your teeth are healthy at the core. So consult your dentist for proper diagnosis and treatment. Thank you for dropping by.
Thank you for having me.
Until next time, adios.